Hi, welcome back. I'm your nurse Nancy. So today we're talking about how to get ready for the job interview. Okay, you did the hardest part of nursing school. You finished nursing school. You graduated. Yay! Congratulations. Now it's time to find that job. It's time to find the first job ever in nursing. So exciting. I know you can be stressed out. You don't know what questions to ask, what questions are going to be asked to you. That's why I'm here. Okay. So if you're just finding me, I'm Nancy. I talk everything nurse. I've been a registered nurse. I'm a med surg nurse, and I'm here just to share my nursing journey and share tips to all nursing students and also anybody that's interested in becoming a nurse, because nursing is an amazing career. So you have you graduated, you have an idea of where you want to work, right? You've done your researches, you've had enough time throughout your clinicals in nursing school to go into different hospitals in your area, and you kind of know what you like and what you don't like. So make a selection of the hospitals that speak to you, that you think align with your values, and you think you're going to grow and have a nice nursing career. Very important. You have to like the organizations, meaning you have to look up those hospitals. Okay, don't just go and apply at any hospital because you need a job. No, you want to research the hospital. Take your time, research, have a top 5 or top 10. I had a top 3 number of hospitals that I wanted to work at, just because they were that good at technology, and I knew that that's something that I need, so I can have those skills as well. And also the patient reviews are very important, and the culture of the hospital very important. So research, have your top 5, your top 3, and then start your job application. So you have to have a nice resume. So I know the last year of nursing school, they make you have your resume ready. So you work with your career services and everything. So your resume is already good, right? But if you need help, you can always reach out at your services at your school, so they can help you out with the resume. So have a nice resume, a nice cover letter. And now the questions. Hey. I know that's why you're here. What questions and how to answer to the questions. So tell me about yourself. Okay. That's the first question. Hello. Nice to meet you. Tell me about yourself. My name is Nancy. I'm originally from Congo. I grew up in Ivory Coast. I flew the war in Congo, moved to Ivory Coast with my family. It was a hard time for me just seeing how people were laying there, dying due to the war. And I saw these amazing first responders taking care of people and trying to save lives. And that what sparkled my love for the healthcare in general, but for nursing in particular. So that brings you into the question, why nursing? They will always ask you this question, why nursing? Don't tell them, well, because I love taking care of people. No, that's not enough. That's not enough. Why nursing? There has to be something in your life that made you want to be a nurse, right? For me, it was the war. For me, it was the first responder taking care of these people, and also my grandpa that died from a complication of diabetes. He had a wound that never healed, and I was around people taking such a good care of him, that I saw that I was like, wow, I want to be one of these angels. Okay, so it has to be one thing that made you become a nurse. Okay, for some people, they were in a car accident, they were in rehab for too long, and then they witnessed good care, they witnessed empathy. So you want to give that, you want to do that for your patients. So that is the why nursing. Okay, tell me how you work under stress. How do you work under stress? You have to be able to tell them that stress will always happen, especially when you're dealing with people that are sick, that might call rapid response, and also working with different team members. Stress will happen, but I'm good at managing stress, working through a stressful environment. You can give them some of your experiences. Even working in a restaurant is stressful. Working in a kitchen restaurant is stressful. So give them some of your experiences that you've had in life before coming to nursing, and tell them that I'm gonna use that to be able to handle stress and stay calm and prioritize. So they want to hear that you want to stay calm and prioritize, and make the good decision, and not just make any decision because you are under stress. You know what I mean? Another question would be, how do you work as a team member? they want to know that you are able to work with people. Things will happen. We always know that you will have people wanting to sabotage you, wanting to backstab you, wanting to, mean people at work. But how do you handle that? So you have to be able to tell them that I'm a good team worker, and I feel like there's no I in the healthcare. There's no I, it's always a we, because I can't be doing CPR and resuscitations and ventilation and counting and doing all of that. It's a we group, it's a we. So I feel like every team member is an important part of the team, is an important part of taking care of patients. So I love working with team, with with people. I get along easily with everybody and all of that. And then that will bring another question, which is, how do you handle conflict? How do you handle conflict? Conflict will happen, right? You'll always have mean people. As a nurse, you will be managing the techs, right? You'll be managing your CNAs. So sometimes you will have people that you just don't see eye to eye. So how do you handle that? And then you will have colleagues that think they know it all, or they try to put you down or whatever. They will always have conflict, even with your manager. So they want to know that you are able to surpass the conflict and look at the bigger picture, which is your patient safety, your patient care, and why you're there. So for that question, I always tell them conflict will happen because we are human beings. Misunderstandings will happen because we are human beings. But how do you deal with it is the most important. So let's say a tech did something or a nurse did something. I will call them to the side and be like, hey, I'm not sure what happened earlier, but this made me feel like this, and see how they react to that. Usually people react okay when you talk to them with a calm tone. You don't come at them hot, like they say. You have to be calm and talk it out. So that's the first step. You talk it out to them, and then if you see that it keeps happening, no matter what it is, keeps happening, then you reach out. You tell them, I'll reach out to the managers so they can try to handle the issue. So that's that for that question. That's beautifully answered. You're not there to fight people. You don't want to fight anybody, but you want to resolve calmly the conflict if it happens. Okay, and then they will ask you, tell me a time where you had a difficult patient and how did you handle the difficult patient. So give them an example. I have many examples. I walk into my shift, I will find a patient very upset because they haven't had the pain managed well, the schedule and the PRN pain medicine is not working for them. They're upset and everything, and usually it's my sickle cell patient, and that's not what they get at home. Pain is not well managed. So I will calm them down and tell them, hey, just coming into shift, I will take a look at your chart and communicate with the doctors and see what can be done, right? So after communicating with the doctors, I can ask them to give them a breakthrough pain medicine, right? Or up the dose based on what they get at home, or have a team member from the pain management team, because you always have those people in the hospital, to come and see the patient and hear it from the patient perspective. Because I'm just relaying the patient concern, but it's always good to have someone come and assess the patient and find a solution for that. So I would do that, and then a breakthrough payment will be ordered, or someone will come and assess the patient and resolve the pain issue, and then boom, that's how you solve a difficult patient, and patient will be happy for the rest of the shift. Hopefully, we can. Some patients are impossible, but most of them will be happy. So that's that, and then a family member too. How do you deal with difficult family members and stuff like that? Just be like, hey, I know it's stressful to be in the hospital. It's stressful to be sick or have a sick family member. I try to put myself in their shoes, calm them down, and see what's the problem. You have to assess the problem and be able to escalate. Exactly. Escalate. Bring it to the charge nurse. The charge nurse, if they can't solve it, they'll take it to the director, and on and on and on. Or patient advocacy, or patient anything. So be able to escalate and everything. So what else question can I ask you? So they will those are the big questions that they will ask you. Some questions will come, tell me when a patient did that, or if you have a blood pressure, no, blood sugar glucose of 40, what do? You know that it's an emergency. You go by the protocol, you give glucagon, you give dextrose. Those are the situational into deep questions depending on the hospital. And then they will tell you, oh, tell me about your qualities, right? Tell them that you are a fast learner, you're always open to learning, you're always open to feedback, right? You are new, you are learning nursing, you are not perfect at it, so you are there to learn, so you're open to feedback. Love, love, love hearing that. And then they will ask you, what is your, tell me about your weakness, right? Weakness, that catches you a lot. Don't tell them, oh, I'm bad at organization, I'm bad at this or that. No, you want to take something positive, make it negative. So it can be like, hey, I'm a perfectionist. I like things well done. So it takes me time because I'll go over and over my charting just to make sure it's perfect. So sometimes it takes me too long. So I finish late before going home. But I'm working on time management. I'm working on, trusting myself to have my charting to be perfect. But there's no perfection. But I know my skills. I know how I chart so I can, spend less time double, triple checking myself. Okay. So it's a good, but a bad, but you have to find to give them a solution. What are you doing? How are you working on making the good, that bad be good? There you go. Okay. And they will ask you, do you have a question? Do you have questions for us? Yes, you always have questions for them. You do, always. They love having questions. They love answering questions. You should be like, hey, how do you love working on in this organization? They'll tell you, for how long have you been working here? How do you like it? What do you like the most about this organization? They'll talk, 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 talk. And that's important. And then ask them, what's the culture of the unit? What's the culture of the hospital? They will tell you the culture of the hospital. And then don't forget to ask, you can ask the ratio. What's the ratio? Nurse to patient. They'll tell you 1:5, 1:4, 1:3, and everything. If they ask you about the salary, just tell them that you're gonna align on what they pay in the hospital. You don't want to sell yourself too high or too low. That's that. So these are the most important questions that today I ask as a nurse supervisor if I have to, be part of interviews for new grad nurse or new nurses, experienced nurses, or CNAs. So those are the main questions. And if you're new here, don't forget to subscribe. I'm your girl Nancy. I will be posting lots of videos about nursing. If you're a new grad, if you're a nursing student, if you're thinking of nursing student, this is the place for you to be. Ask questions. I will answer. You can link with me on TikTok, Instagram, or you can always email me. I'm also a coach, so check my website www.scrublifewithnursenancy.com. You can schedule a consultation so we can meet, and I will help you throughout your nursing journey. So thank you for being here and stay blessed.